The world is no longer a global village, it is a neighborhood. Generations come and go, but the gist they start lingers. The platform that sustains those gists is here. Be a part of the conversation on Generations Gist with Joy, from policymakers to politicians, medical personnel to traders, labor leaders to students, the young and the old. It's Generations Gist with Joy on this channel every Saturday at 9 a.m. with a repeat broadcast on Sunday at 9 a.m.
It's your generation, it's my generation, it's our generation.
Come, let's tag along on Generations Gist with Joy. Please join us.
Hello viewers, welcome to Generations Gist with Joy once again. Generations Gist with Joy is a show where we feature in-depth discussions, analysis and overview of trends, lifestyle and other issues that affect both the older and new generations, as we x-ray and showcase how generational transition and individual experiences and relationships have impacted and shaped contemporary human behavior and national development and advancement. Today's conversation promises to be eye-opening, refreshing, interacting, and educating. Please do relax and enjoy the show. I am your host, Joy Onu. But before we continue, we shall be going on a short break. Please stay tuned. Welcome back. The topic for today's discussion is mental health disorder, stigma, access to therapy and treatment. According to the World Health Organization, mental health is a state of mental well-being that enables people cope with the stress of life and realize their ability to learn well, work well, and contribute to their society. In other words, a sound mental health is essential to a balanced or a healthy emotional, psychological, and sociological interactions for a progressive society and development. While appreciating the importance of a healthy emotional or mental health, it is also of note that there are several indicators that mental health illness or disorder are on the increase and affecting productivity and performance in workplaces, homes, schools, and even increased risk of suicide. Research has shown that mental health disorder or illness affects 19, 46, and 13% of adults, teenagers, and children respectively yearly, while only about half of them access medical treatment or therapy. In the studio with me to help enlighten us and do justice to this important topic are very special guests. I have with me to my left Dr. Samuel Abah, a fellow of the National Postgraduate Medical College of Nigeria and a consultant psychiatrist. He is currently the head of Department of the Mental Health Department of the University of Abuja Teaching Hospital, UATH. You are welcome on the show.
Thank you very much.
To my right here is Associate Professor Emmanuel Alhassan. He is the Associate Professor of Psychology, Nasarawa State University, Keffi. He is the immediate past chairman, Nigerian Psychological Association, FCT chapter. You are welcome on the show, sir. Then you know the topic. We are discussing mental health disorder, the stigma and access to therapy and treatment. So right now, you know, there are these things people say that no matter how healthy you are mentally, that there is this element of disorder or something that is not complete about you. Is there a significant difference between mental health and mental health disorder? I'll direct this to Dr. Abah.
Thank you very much. Mental health can be defined as your ability to know yourself, know your capacity, and ability to use what you have known to impact your generation, your society, and your environment. That simply means you must be productive. Now, it affects your emotions, your brain, and your mind. Anything that makes you unable to perform your daily function affects your mental health. And that's why it is said there is no health without mental health. Now, a disorder is any factor that hinders your mind, your emotions, or your brain to perform effectively, thereby reducing your capacity as a person in the society, in your family, in your environment. At that point, we say you have a disorder. So there are two different things. Now, because of the situations of the environment we are in now, people end up having a lot of mental health issues. Mental health issues does not necessarily mean what people in Nigeria calls it, which is somebody that is mad. Madness is an extreme of a mental disorder. A lot of people have mental disorders but are not, in bracket, mad. So we must be able to differentiate the two. That being mad is an extreme. On the other spectrum is a situation whereby you are still in your mind, but you are not being able to function to your full capacity. You also have a mental disorder, but the milder form. Those are the two types of mental illness we have, the mild form and the severe form. And it affects people in different grades. It is said that 1 in 8 in the whole world by WHO have a mental disorder. So that simply means you can't aid people. If you are not careful, one will be found to have a mental disorder. Examples of mental disorders, the simpler ones could just be anxiety, depression, while the severe ones, which is so common, like Nigerians will say is coloing, is schizophrenia, bipolar, affective disorders, and mania. All these ones are the ones at the extreme.
Okay.
Yeah.
Okay, in your own perspective, what would you say are the significant difference between mental health and the disorder as a psychologist?
Yes, so if you have good mental health, it means that your state of psychological well-being is okay, it's fine. It means that your cognitive and somebody might want to use the word mind, the way you process your cognitive processes. It means that you weigh things before you act. You don't have a tendency to reckless behavior. You don't have a tendency to behaviors that could endanger your person or endanger others. Okay. That is a state of sound mental health, a state of good psychological well-being. He has already touched on what mental disorders are. It means you're not functioning optimally, you're not functioning well. And the thing is, at one point or the other, it can be argued that based on underlying factors, okay, that most individuals, if not all, would have at one point or the other. Okay. If you look at the level of stress, for instance, that can induce or that can precipitate, mental disorder, we have different thresholds for different people. We also have different touch points. Something that can trigger a state of mental disorder in one person may require a higher threshold, maybe with another person. Yes, and in terms of the immediate ones that affect most people that this doctor has already spoken about, we have anxiety, and we have different types of anxiety, and so on and so forth.
Okay, we'll come to that then. How do we actually identify those who are mentally ill and those who are not?
So, okay, I would be a little bit careful with the terms, like when you say mentally ill. Right. If you have a headache, are you ill? So I will be a little bit careful with terminology. But from the mild to the severe, for instance, somebody who has a panic attack.
Okay.
Let us say somebody who has a phobia for crowds. If you place that person in a crowd, they won't be able to cope. It's even worse when you say they should come and speak, or when they have to face a panel or something like that. Some could actually begin to have shortness of breath. They could begin to have palpitations. Okay, these are some symptoms of anxiety. Okay, for depression, for instance, you could have withdrawal, extreme withdrawal. You can find somebody who was not smoking before suddenly begin to smoke, and smoke very heavily. And this could be precipitated by different things. A simple example, when I was in secondary school, we had a Canadian couple, very nice couple, very, very nice. They were good teachers. They were very happy. They were living in the staff quarters. When they had their child, their first child, everybody knew about it. We all knew they were very happy. And then, all of a sudden, the child took ill and died. And then the gentleman and his wife withdrew. He started growing a beard. He started smoking and drinking heavily. And eventually he left abruptly. So such symptoms could be signs of, a mental disorder.
Disorders. And you who is always in the clinic, so to say, what do you say are the signs or people identifying people who have those kind of disorder or issues, so to say now, because not illness, let me not put it that way, not illness.
All right, so let's start with basic things. I don't want us to look at the extreme now, because that one is meant for the specialists to look into.
Okay.
But let's look at the common things around us, particularly now that almost everyone in Nigeria is stressed. Now, the basic thing you would notice about people is their sleep pattern begins to change.
Okay.
People no longer sleep enough. They are worried. They spend time thinking over issues that they cannot solve.
Okay.
The appetite, for some, will reduce, and for some it will increase. So, accompanying that, you see change in weight. And then some of them begin to lose pleasure in things that that was pleasurable to them before.
Okay.
Suicidal thoughts begin to come in. Suicidal ideations and plans start coming in. Hopelessness, helplessness begin to come in. All these are things that happen within your mind that is private to only you. Somebody else may not know.
Okay.
And then you get to what Associate Prof said. You begin to isolate yourself because you feel overwhelmed. You feel you are not really performing to your ultima. So why should I be alive? Why should I contribute? So you begin to withdraw yourself. And then you no longer associate people. And then that alone gives room for these other thoughts to keep multiplying. No longer sleeping. So these are simple things that happen to us almost on a daily basis.
Okay.
And they are all symptoms and signs of mental issues.
Okay. Because I heard somewhere one mental health experts.
Yeah.
I was watching the show, and they were talking about if you meet people at a function, they are hyper. They are the ones that dance more. They are the ones that feel so happy more than any other person. There is an issue. Now the question that takes me to the next question now. Are there different kind of mental health, and can you categorize them? Because like we want to know what the categories of mental, because in this our climb, I'm very sure mental health issue is not taken seriously yet. I don't think it is taken seriously yet. If it is taken seriously now, are there different kinds of mental health, and what are the categories?
Now, your mental health is your mental health.
Okay.
It could be hampered, it could be good. If it's good, you are at optimal. If it's not good, like we said, then I will now begin to have degrees of impact upon your mental health, which is from what you said, the mild. You still go to work, but you're not doing well at work. The same workload, but now you can't complete those tasks as you used to do. Something is wrong. These are red flags. Then gradually, no more going out for breaks, no more associating with your friends. These are all red flags. We call those ones the mild symptoms of mental health disorder. Okay. Then gradually we'll now go to the moderate, where it is no longer just you alone. It's affecting, assuming you have a family, it's affecting your family relationship. It's affecting your community. You are a church member, you no longer go to services, no longer join the groups. You are an association member, you are no longer participating in the association, and a lot of things are coming on. Now at this point, your functioning is affected, even though very small. Then gradually we now move from that level to what will come the severe one, which is the obvious one to everyone. Because at that point you are misbehaving, you have abnormal behavior, irrational talk, you can do and undo, scatter things, aggressive and all those. So those are the severe types. So we have the mild, the moderate and the severe types of mental, let's use the word illness now. Again, I'm saying illnesses. So depend on what an individual has. We attend to the individual separate. Those that have mild to moderate, fine. You could pick that one up because maybe somebody in the house just noticed, you are not going out like you used to go out again. What is happening? That may not even require so much. If we are very observant around, we can pick that up.
Okay.
Yeah.
So in addition, just to add to what he has said, we have different categories. You can have mood, disorders. You can have so from like general anxiety disorders to specific to some are even seasonal, anxiety. For instance, at a particular point in maybe in a year, people fall ill. People mentally, in quotes, and then so for instance during the rainy season, some people now feel extremely depressed.
Okay.
Sometimes people it might be when they had the anniversary of a traumatic experience, maybe the loss of a loved one, maybe a divorce and things like that. Then we have, when you begin to look at the psychotic cases where people are hearing things, they are seeing things other people cannot see. There's a particular case of someone who lost his wife, and then he now cannot take decisions until he hears from the wife. He will tell you he has to hear from the wife, who is already dead. His own reality is different from the general reality. That's when you begin to have those extreme, cases. You have hallucinations, you have delusions, like delusions of grandeur, delusions of persecution, people feeling that they are being unduly persecuted. And so they could act aggressively with little stimulus. They assume something that perhaps is not real. So we have different degrees, like he has said. And for the extreme, like schizophrenia, then that would now really require psychiatric attention.
Okay.
Of course, there is bipolar. Now, mood swings. Most human beings have mood swings naturally. Sometimes you are happy, sometimes you are not very happy. But when it is sudden and it is extreme, somebody who is extremely happy today, then the following day is extremely sad or unhappy, and then it is persisting beyond 1 day, 2 days, 1 week, 2 weeks. It becomes a consistent pattern. Then we now say you have a bipolar disorder. And that is something that really needs psychological and sometimes psychiatric attention.
Okay, in other words, from what you are saying, bipolar is a mental health issue.
Yes.
That should be attended to.
Certainly.
Okay, now, what are the risk factors and who are the most vulnerable to mental health issues? Okay, so again, let me quickly say that we're trying to discuss this in very simple terms, and we're not necessarily but in terms of risk factors, number one, there is what we call genetic predisposition.
That's right.
Okay.
And that is why it is important, I think, for public health facilities to begin to look at, equipment that can do a good analysis of DNA. A full analysis of your DNA will tell you if you are prone to diabetes, you are prone to cancer, and things like that. Even substance, particularly alcohol, there are studies that have shown that there are people who are more susceptible if other factors trigger their tendency to abuse substance. So we have genetic predisposition. So knowing yourself very well is important. Doing your medicals, your genotype, those normal things, and also doing an analysis, of your chemical composition of your body. I will give you an idea. Number two, we have environmental factors, and this could range from relationship issues, people who have had a terrible emotional trauma, either due to a breakup or a disappointment, or or you feel or physical or psychological abuse. Sometimes the psychological abuse is even more deep and could hurt people more than physical abuse. There is socioeconomic factors, which he has already touched on, and sometimes this could trigger substance use and things like that. Sometimes it's substance use that would trigger other mental health issues. But practitioners have found out that for substance use, which is also another issue, peer pressure accounts for more than 60-70% of why people go into substance abuse. And just because of time, let's quickly also jump into this caution to parents and to also young persons, because prevention is better than cure. Once you get into it and you become addicted, the chances of getting out of it are very, very slim.
Thank you very much. We'll go on a break.
The world is no longer a global village. It is a neighborhood. Generations come and go, but the gist they start lingers. The platform that sustains those gists is here. Be a part of the conversation on Generations Gist with Joy. From policymakers to politicians, medical personnel to traders, labor leaders to students, the young and the old. It's Generations Gist with Joy on this channel every Saturday at 9 a.m. with a repeat broadcast on Sunday at 9 a.m.
It's your generation, it's my generation, it's our generation.
Come, let's tag along on Generations Gist with Joy. This Join us.
You are welcome back. We are still on Generations Gist with Joy, and the topic is mental health disorder, the therapy and the stigma. You were saying something about mental health issue and what predisposed them to having mental health issue.
I was at some point talking about cognitive processes. And also talking, then the other is emotional processes, and a lot of times emotional, processes sort of override, and that's why, for instance, when people go, there's what we call impulse purchases. You go to a supermarket, you didn't actually plan to buy something, but either because your friend or your wife or your husband, or your children, you buy it. That is a situation in which your emotional your emotion has taken over, cognitive processes, which is more of knowing exactly, doing a thorough analysis before taking action. For some cognitive processes, we have that could be precipitated by, by maybe an accident that has affected the brain, so that again is one of the things that could cause, mental disorder.
Okay, doctor, talking about the risk factor and those who are vulnerable, he said the people take action even they didn't plan for, isn't it? So that could be another factor. Would you say that that is also a disorder?
It might not be a disorder per se, but at the same time, there's a thin line between a disorder and mental illness and the norm. I think I should emphasize that now. Right. If you don't have the money and you follow your friend and you have to go into spending spree, and maybe you decide to now use the app to borrow money, you've gone off the line.
Is that a mental health issue? At that point,
it's a mental issue, because
once it's consistent and persistent,
you are no longer being able to control it. Is that right? Fine. So that's why I say there's always a thin line between what we discuss as symptoms of mental illness and the norm. Take, for example, hearing of voices is a very common symptom in chronic mental illnesses. But almost all of us will say we hear God's voice. We hear voices. So you now have to be able to differentiate which is the correct voice and which is the bad voice. And again, I'll say it again. I like using this example. Everyone gets naked once in a while in a day.
Yeah.
So it's not bad to be naked. But to see the madman on the street, I will say he's naked. I will call him a madman. What's the difference? Where he is, the environment, and the circumstance. It's the same thing, but it's a thin line. So that is how it is when it comes to mental disorders. We're not talking about things that are in the blues. No, we're talking about things that are common but inappropriate for that particular time and for that particular situation.
Okay. Then again, children.
Yeah.
There are children who are hyperactive. There are children who do certain things that are not supposed to do. And we don't seem to focus on that also. Our children also, can they have mental health disorder? Then again, how would you identify the mental health disorder or mental health issue disorder, and at what stage do you think they should access help or medical facility or even therapy?
For children?
Yes, for both children and adults. But I want to ask about the children own, because a lot of, in our own time right now, I don't think there is emphasis on children mental health. You know, a child does something, the next thing is to scold the child, beat the child, you are stubborn, you are this. But ordinarily there are some children that are extremely calm, extremely hot. So at what point, how do you now identify, or parents now, how do they know that this is not normal? And at what point should they access medical facility or take them for medical treatment or even therapy?
Fine. Mental illness also occur in children.
Okay.
In short, we have psychiatric, childhood psychiatry as a field on its own. Now, but many people are not conscious of it or aware of it. And there are a lot of issues relating to children, starting from autism, which occurs early, before the first 3 years. They will have issues like conduct disorder, which is also common. We have separation anxiety even in children. So, of recent, I've discovered that even suicide is common among children now. This year alone, at least I've seen almost 4 or 5 before children before the age of 16. I remember one was in primary 5, and that's small. So they'll have extreme cases where they have psychosis. So whatever I can see in adults can also be found in children. So it exists. It exists. And they're also being attended to.
Then at what point should they now access medical facility or therapy?
Depend on the challenge the person is having. Take for example, let's say autism spectrum disorder now. I'm talking about a child who always likes to stay alone, does not socialize with anybody in the house, whether he has brothers or sisters, it's not his business, and then has speech impediment. Definitely you know that a child at the age of 1 should have some advancement, milestones to have been achieved, and then if he doesn't achieve that, you should know that there's a challenge. So you should be able to access help. When children are growing, getting to 5, 6, 7, and that guy is extremely terrible, steals, does all these things, he has a conduct issue. At that point, the parents should also know that this guy is not normal. That's what I'm saying. So it's the parents' ability to identify this stuff and not just explain them off. Take for example attention disorder, attention deficit hyperactive disorder, ADHD. You have a child that is 2-3 years. You should expect that when you get to a place, you say sit down, the guy should sit. But you get there, the guy is everywhere, jumping, climbing. He sees a visitor, he climbs the visitor. You know, something is wrong. But most times we think maybe we should just allow him for now. Then he continues, yes, but 1 year, 2 years, still doing more and more and more. No, you should seek for help. Maybe most people are not aware that it exists. There's help for those kind of children, but help exists for children that have any form of mental or psychological disorder. You are in the university environment, and I guess you see some of those things.
Absolutely.
What is your experience and your perception?
Before they even come to university, before secondary school, there's primary school. And I'm very happy that you brought this up. It's important to address our socio-cultural issues, particularly here in Nigeria. You know, and depending on which generation, we have different approaches, you know, to bringing up children. There's the example of, oh, just leave him or leave her. You know, this is not 40 years ago, you know, the children are now, and then you leave the child, and then by the time you are trying to deal with it, it's too late. So the earlier it's identified and dealt with, the better. On the issue of culture, a lot of people, we have cultural beliefs of witchcraft, you know, and supernatural, and this is a big challenge. And there are a lot of things that are not spiritual, in quotes, you know, that are purely physical and mental, and we need to identify, and they're different. Immediately there is a consistent pattern of behavior that is not within what is considered normal parameters. You need to seek help. You need to do all the physical medicals, you know. You need to do, there could be, you know, there could be hormones, it could be excess of certain, you know, of the things in the blood that could either lead to hyper, or, and those are things that can be checked. And then you can also do simple psychological assessment. Do a personality test. What kind of personality does this, and other tests that would help you situate where the issue might be coming from. You might now actually even discover that there are certain things that triggers those behaviors, and then you now apply the appropriate therapy. You see, if for instance it's an unnecessary fear of something, an unreal fear like a phobia, you know, there are different approaches that you can use to help, and the earlier it is dealt with, the better. The other issue is religion. When we say, oh, I heard, like my colleague said, I heard voices and I heard the voice of the Lord. Look, we have a colleague who attended to a bishop, you know, who at some point, and this bishop actually has hallucinations, and he hears certain things. He also has delusions of grandeur, and he will see you and tell you that you are cursed because the watch you are wearing is inferior. It is not. Look at my own watch. My own watch, I used so thousands of dollars, you know, to buy my watch. Now, this is a revered, you know, person. And so the tendency will be for the followers to agree. Then he will tell you to kneel down. Okay? And then you have now accepted that you are cursed. You have accepted that your wristwatch is inferior. Okay? But if you now tell him, sir, my watch is not cheap. I am blessed. The Bible says that I am blessed, I am not cursed, and that there is no way anybody can curse me. Then he will, the same, will now say, oh, okay. So you mean this, your watch is very expensive? Oh, okay. You are no longer cursed. So you see, we have to pay attention, and the things we expose our children to, the things that we ourselves, our belief system, the things we internalize without actually even interrogating, you know, they are very important, because this could affect you have a child who, due to peer pressure, is already hiding in his room. He doesn't want to come out. He doesn't want you to enter his or her room. And then one day, he forgets, leaves his door open, and you find substance. And the next thing you are saying is the devil. The next thing you are saying, instead of quickly, you know, planning how to get, you know, medical attention for that child, get psychological, psychiatric attention, and see what you can do, because the relapse, for instance, for substance use, most of those who find it very, very difficult are people who started a long time ago. And the longer you are in it, the more difficult it is for you to you know, to leave. So these are the things that we need to look out for.
Thank you. Doc, both of you just said something now about, I think, personality disorder, so to say, of seeing your own as inferior or superior, or the mind game, and so on and so forth. Is it treatable? Or are they treatable?
Yeah, let's go this way. Disorders are treatable. Some may not be curable. So
but managed.
Managed.
Okay.
And the difference is this. Most mental illnesses are chronic issues. So what we do is, we don't cure most of them. Some are cured, but we can't specify most of them now. But for those that cannot be cured, we manage. You either go through the psychotherapy, psychological treatment, or medications, and then you are taught how to manage the situation, and then you go on with it all through. It's not the only illness in life that does not have cure. HIV doesn't have cure for now. Diabetes doesn't have cure. Hypertension doesn't have cure. So there are so many cancers doesn't have cure. But we manage people through them, and they live their life. So if it's being managed, you could live your life well.
Okay.
Yeah, I tell my patient in the clinic that for me, if they ask you to choose between hypertension and mental illness, why not choose mental illness? Because you can manage this illness if you agree to manage it, and for the next 30 years, your next door neighbor who lives very close to you will never know you have that illness.
Okay.
Because it's manageable.
Okay.
Even though some of them are not cured. And if you are lucky to have the one that can be cured, beautiful.
Thank you, doctor. In the realm of mental health, misconception, misunderstanding, and even stigma abounds.
Very well.
What exactly are those misunderstanding and myths? And what do you think can be done to debunk some of these common myths in order to help families of victims and even victim themselves to assess or to be able to on their own go visit centers, therapeutic centers and hospitals?
Right. Stigma is a very big challenge when it comes to mental illness. And we have two types of stigma. We have the public stigma, which is what people perceive, and a lot of myths about mental illness. And they'll have the internalized or self-stigma, which really is for the patients. How down because of what the public feels, they also feel concerning themselves. So let's start with the public. Now, a lot of people believe that mental illness, like he said, is caused by the spirit, by demons. Well, I won't say no or yes, but scientifically, we always tell that there's always something that is causing the problem. In Nigeria, not only Nigeria, most African nations and even in the world, before they come to see a psychiatrist, they've gone to see the reverend, they've gone to see the father, they've gone to see the imam. It's when it's beyond their capacity. Then the psychiatrist or the hospital is the last resort, because they tell that this one you have, no be hospital problem, now spiritual problem. And how can you take spiritual problem to
the hospital?
To the hospital. But few that have decided to come to the hospital have discovered that, look, that is the way. I had a patient some years ago, and when he came, somebody referred him to me, and I said, okay, what's the problem? He said, for the past 2 years, he has been going around, he has gone to prayer houses, they asked him to buy chair, they asked to buy microphone, he has done that, did everything he could do, but the problem has been ongoing, to the point that he could no longer drive himself because of the fear and anxiety he has. And after we started, and I told him we're going to take some time, but let's see how it goes. Within 1 year, he's back, he's driving, in short, he has relocated to the UK now.
Okay, now, you want to answer the question?
No, go ahead.
Okay, now, having said all these things, anxiety and other issues, disorders, could help, they could, are the causes of mental health issues. How, at this point, what do we advise those individuals, even people, because a lot of people have issues in marriages, they have issues in their workplaces, like Dr. rightly said, Prof rightly said, and at what point do you think, I think I've asked this question, how would they know, me now for example, I have issues, let's assume I have issues, how am I going to know it is a mental health issue? Because the awareness, I'm not very sure this awareness is common right now.
That's true, that's
is it
true.
right to first of all see a therapist or go straight to the psychiatrist?
The awareness concerning mental illness is increasing. It has, I think for now, it has increased beyond where it used to be, even though we are not where we ought to be. People are getting more aware that, look, man, this thing that we think is spiritual is not spiritual. We need to be attended to. So, and there are managed drugs, there are ways to manage it, there are psychological ways to manage your mental state. So what we need to do is, people need to understand that, look, if I am no longer thinking well and I'm not functioning well, I need help.
Okay.
Now, going for help is not a sign of weakness, which is what is making a lot of people not to seek help.
Okay.
Because of the stigma we're talking about, people don't associate with anything mental health.
Then we'll come back to that after this break.
Okay.
Please stay tuned. You are welcome back. Doc, you were saying something.
Yeah, I said the might that people have concerning mental illness is what makes us not to seek for help. And it's not a weakness to seek for help. It's a wisdom that I can no longer balance myself. I need assistance. Now, seeing a mental health professional does not equal to you are mad. Abroad, you are jilted, they encourage you to see a psychologist or a psychiatrist. You have been kidnapped, you see a psychologist or a psychiatrist. You have a marital crisis, you see a psychologist and psychiatrist. So it is a way of putting their people back into functionality. Now for us here, yes, if you feel you are down, all you need to do is, if you don't want to see the psychiatrist, see the general practitioner. They go through postings as they are passing through their trainings, and then they will also help you out. If they cannot, they will now tell you, I think at this level that you are, you will need to see a psychologist or you need to see a psychiatrist. You know what I'm saying? I've had patients that went to see the ENT, went to see the surgeons because she was hearing noise in her ear. And they told her, go and see the psychiatrist. We've done all we can. He said, lie, I'll never go to see a psychiatrist. It was later on that she had to come. And within 1 year, she was done. So it's a matter of understanding that seeing a psychiatrist is not bad. Yes, we know that there's stigma even in the hospitals. When you say a psychiatrist, they say, hey, he behaves like his people. That's what I'm saying. So when you now go to see a psychiatrist, they will now say you are mad.
Okay, because I remember in a political setting, sometimes, you know, some people that goes to see psychiatrist or maybe a psychologist will be used against them in politics, like he's mad or he's not mentally stable, he's not fit to be our leader and all those things. How do we address that? How do we address that?
I like the fact that you made it very simple by saying, how do I know? You know, and if I begin to feel, what do I do? That's my starting point. When you have persistent headache, when you have stooling that is uncontrollable, when you have joint pains, headache, you can't get out of bed in the morning, what do you do?
Seek help.
You go to the hospital that you call your doctor. That is what you do as a routine. So we should routinize.
That's right.
Mental health issues. It is normal, in quotes, particularly given the climate change impact on health, social impact on health, insecurity issues.
Too much.
You know, a lot of people in the Northeast, the number of cases of post-traumatic stress disorder is, and you see, it's because of the big names that we give these things. Perhaps we should come together and begin to look for names that people can relate with. If you have gone through your, bandits or terrorists come into your community, kill your parents in front of you, or kill your children, that is trauma. Okay? And you're going to have post-traumatic stress. And if you don't deal with it on time and becomes a huge disorder, that is an issue. So let us routinize it. Let us seek help. And we have psychologists, we have psychiatrists. It is important, just like you have the number of your doctor, the number of your mechanic, in your on your phone. You should have a psychologist's number. You should have the number of a psychiatrist. For in terms of legal frameworks for politicians and people who are appointable, to maybe public office. And we've heard of, we know that, for instance, I think recently there was talk about some candidates who were screened for substance abuse. And quite a number were abusing substance. Now, if it is of a significant level, that certainly is going to affect, because once you get into substance abuse, one of the things that will happen is you are going to look for money to fund it. We've had a case where somebody sold properties worth 2 billion at different times, spanning a period of like 3, 4, 5 years. Properties worth 2 billion to sustain
that lifestyle.
Substance.
lifestyle. So it's important to, in a very responsible manner, have these things in our legal framework.
Okay.
You know, and separate the ones that are severe enough to affect your behavior, your conduct when you hold political office or you are given an appointment to hold an administrative office.
Okay, let me ask you, from what you are explaining right now, as a psychologist, are they supposed to be elected into office or appointed into offices?
The way to answer this, to respond to this in graphically and in a simple manner, is like asking, when somebody is sick physically, should somebody with malaria be allowed? Certainly, because that is endemic, and that is something, you know, that you, again, if you have it, you can treat it. There are many ways to prevent things like that, and it is not something that is so debilitating as to incapacitate your physical.
So in other words,
then there has to be a threshold. Is if it's, you know, if it's mild anxiety, as distinct, for instance, from schizophrenia. These are two. So certainly, those with those extreme that are already impacting on them, you know, that their behavior, their functioning, certainly
shouldn't be allowed.
You know, those are things that need to be, and that is why thorough assessment, not just a psychological test, not just 1 or 2 tests, but a comprehensive assessment, taking into consideration all the, and that's why those assessments by a team, you know, psychiatrists and other health, you know, workers, psychologists, social health workers, is important. And I think this is a very interesting thing you're talking about. I think the future of our polity should actually incorporate things like that.
Okay, in other words, you are saying that whoever wants to aspire or be elected or be appointed into offices should be looked into, a team should look into the situation of mental health to see the severity before that person is given the chance to lead. Okay, thank you. Then again, at what point or how do we really prevent mental health issues? Is it preventable?
That's why I say prevention is better than cure.
Okay.
Anything that has risk factors, if you pay attention to the risk factors, even if you are going to have it, you prolong that period. Okay. Even if you are genetically predisposed, it doesn't mean automatically you are going to have it. Okay. There are what we call trigger factors that's going to bring it up. So if you avoid those trigger factors, what happens? The genetic predisposition will still remain there, but will not trigger it up.
Okay,
yes, so train your children. Yes, train your children to have high self-esteem. Train your children not to be vulnerable to the opinions of others, not to allow the opinions of others and how other people look at them then determine how they are going to behave. Therefore, peer pressure, you know, they would avoid peer pressure. That is prevention. If you are an adult, and you have friends who, let's use the popular word, that are toxic. If you are amongst a number of friends, you are a man, and these are friends who are talking about how they beat their wives, regularly, and they take pride in it. Those are people you should avoid. If you are a woman and you are constantly hobnobbing with women who are always complaining about men and how you don't need a man in your life.
You know,
so those are some issues. So those are things that we call prevention.
Then for lack of time, let me edge this some of these questions. Will you agree that mental health disorder seems to be more prevalent among this generation? and or the older more than the older generation, or what could be responsible? We have talked about substance, peer pressure, and so on and so forth. Or has it got to do with rise in social delinquency? What would you say has dominated our public health discourse among the younger generation about mental health issues?
So this is an interesting topic that a lot of research needs to be
just
done.
Very briefly.
Very briefly. Let us say that in older climes, there are probably there are cases that are underreported because we didn't have social media.
Okay.
Now we have social media, so the number of incidents that people film on a daily basis will tend, but technology, social media, and influence across borders, where you have social media influencers. Somebody is engaging in consistent, conduct disorder, in misdemeanors, and then they are hyped. This affects children.
Yeah,
so that seems to be a trend, that is also perhaps.
Okay, Dr. Abah, in your own opinion or perspective as a clinical psychiatrist, what should the society watch out for, and what appropriate government policy can check the upsurge of mental health issue?
Now, like you said, we need to be conscious that this environment now is a little bit toxic. People are exposed to things that they are not supposed to be exposed to. They are all age inappropriate.
Okay.
A child in primary school has access to phones, to the internet, and the internet is not censored.
Okay.
If you look at suicide rates, that's what we call copycat suicide. You see it, you want to do it, and this is more common among the young people because they want to copy it. So if we can regulate what our children watch, what is filtered to the air, then we know we can control to some extent exposure. And then fine.
Very importantly,
government, I'm very brief now.
The Mental Health Act needs to be implemented.
Yes.
It is been passed into law. It is not. It's not been implemented.
Cool.
The psychologist cadre was thankfully approved a couple of years ago, but it's not fully implemented. You need psychologists at every level of our healthcare, from the primary healthcare level to secondary and to tertiary. Number 3, the people within that space need to come together and work more harmoniously. These are my quick recommendations. Thank you.
Thank you very much for showing up on my show. Honestly, I can't really appreciate you enough. And by the grace of God, next time, I can't wait to have you again on similar topic. Thank you so much.
Thank you.
And this is the end of today's show on mental health disorder, the stigma, and access to facilities. Well, this is the much we can take on this week's episode of Generations Gist with Joy. But before we go, don't forget to always be a part of this show by following us on all our social media platforms. For inquiries, please send an email to generationsgistwithjoy@gmail.com. And until we come your way, same time next week, remember, your generation is your identity. And let's continue to be our brother's keeper and remain a patriotic Nigeria. I remain Joy Onu. See you next week.